for letting me be here today. Mr. Crouch, always a pleasure to serve with you. And Jesse, thank you for inviting me. On behalf of our employees, I appreciate the opportunity to be here today and to share with you all some information about health care here in Washington County. I think I should tell you that I'm actually a Mobile transplant and have been here for 6 years. I was one of those people Jesse mentioned who used to drive through McIntosh and across to Tom Bigby on my way to Birmingham for college and undergraduate school. I knew very little about this county before I moved here. And in the 6 years that we've been here, I can tell you that my wife and my son and I have developed great affection for this area. It is, we don't have everything that you have in the city, but we have some things here that you can't buy anywhere. And when I go to the post office and the lady there knows my box number and doesn't have to ask me, when I know everybody at the grocery store and at the hardware store, those things like that I can't get in the anonymity of a larger town, so it's a pleasure to be here. It's fun working in an industry that is very much in the spotlight right now, politically as well as socially. It's a challenge for us, but I think we have some exceptional things to offer here in the way of health care in our county. Just to give you a little bit of history, back during the 40s, the Hill-Burton Act funded the building of rural hospitals all across the southeast. And Washington County Hospital is a Hill-Burton hospital. The Hospital Association was incorporated in 1948. The hospital opened in 1954, and then in 1975 we added a nursing home to the hospital. That facility was expanded again in 1981 and in 2003. So today we are a 25-bed critical access hospital. We were the first hospital in the state of Alabama to receive that designation. And what that should mean to you is it simply changes the way that we are reimbursed by Medicare. Years ago, Medicare, after the Balanced Budget Act of 1997, closed about 200 rural hospitals. The federal government, the Congress realized, whoa, we overcorrected, and so we need to go back and find a way for these rural hospitals to survive. We don't do surgery. We don't do coronary artery bypass. And so we don't keep the kinds of patients that generate high dollar acuity levels of disease and infirmity as a larger hospital does, that will allow you to survive under the prospective payment system that most hospitals are paid by. So as a critical access hospital, we are paid on a cost-based basis by Medicare. We are also in the nursing home, 88 beds that we have located in that facility, and largely 2/3 of our residents are, their long-term care is funded by Medicaid. The rest of the residents are there on a private pay basis. We employ approximately 160 full-time people, total payroll when you count our part-time and what we call PRN, that's medical as needed, people that come in and work, almost 200 people. Our fiscal year, which finished September 30th this year, $11.2 million in gross revenue. Don't be impressed by that, okay? Because in the healthcare business, we charge whatever we want. Medicare and Blue Cross and people like that tell us what they're going to pay us. So don't be impressed by the gross revenue. Our payroll is roughly $5.4 million. So we are a fairly large economic impact in this county. One of the things that I'm most proud of is that the people in this county have a real commitment to our hospital. When I moved up here from Mobile, if you stop people in Mobile and say, what hospital do you use? Well, we've been to Spring Hill, or sometimes we go to Mobile Infirmary. But up here, everybody that I met would say, our hospital is important to us. And that commitment is proven by the fact that we receive a $2 million property tax subsidy every year that generates a little bit more than $600,000 for us. We have been good stewards of that money because we have used those dollars to reinvest in the technology and the equipment and to the maintenance of the physical plant, which, as you can imagine, in a hospital that was built in 1954 is something of a challenge. But I'm proud of what we've been able to do over the course of the last 6 years. We have added services in our imaging department, for example, CT. did not have that here. So we have CT capability. In our imaging department, we do echocardiography, ultrasound, general and vascular. We last year replaced our X-ray unit. We do mammograms. We do bone densitometry. And one of the ways that we have put technology to use is that we don't have a radiologist on our medical staff. All of our radiology consults are done by the University of South Alabama Department of Radiology, which provides us with 24-hour, 7-day-a-week radiology coverage. So through the technology that is now called picture archiving and communication systems, by way of the internet, so to speak, the radiologists at the University of South Alabama can come into our system and can be able to look at any image that we do in the facility, which has been a huge upgrade. We literally used to have a courier with a suitcase with x-rays and x-ray reports driving back and forth to Jackson, taking x-ray reports to a radiologist over there. No longer. We are 24/7 now. Our clinical laboratory, we have a full array of services available there, as well as a partnership with a reference laboratory for those low volume but very expensive services that we do. Our inpatient services are generally adult, pediatric, medical. As I said, we do no surgery. We try not to deliver babies unless somebody comes into the emergency room a little bit late in the process, but we avoid that at all costs. We operate a 24-hour day, 7-day-a-week emergency room, staffed by a physician at all time. All the doctors are board certified in family practice, internal medicine, and that type of specialty. We, in the nursing home, typically run about a 90-95% occupancy rate. I want to crow a little bit. A couple years ago, Consumer Reports does a long-term care issue, and they go state by state by state and look at the long-term care facilities that are there. In 2006, there were 12 nursing homes in the state of Alabama that Consumer Reports, if you understand how they do things, they don't really go overboard in saying you should buy this. But we were one of only 12 nursing homes that they said, if you need long-term care in Alabama, we recommend that you consider Washington County. This past year, we are surveyed every year by the Alabama Department of Public Health, which recertifies us to continue to stay involved in the Medicare and Medicaid program. We were absolutely deficiency-free, which is, most years, you end up with 4 or 5 deficiencies, which is, even that is a great survey. This year we're absolutely deficiency-free, so it is a first-rate facility. We were very proud back in July, and I talked earlier about the tax fund and how we have invested that in clinical technology. In the American Recovery and Reinvestment Act, one of the things that the Obama administration has put forward is an initiative to compel healthcare providers to move toward a fully electronic medical record, but no later than the year 2015. We are almost there now. The only thing actually that we have left to do is to get the physicians online, which, if you've ever worked very much with doctors, somebody mentioned earlier something about herding cats. It's working with doctors is kind of the same way, to get them to let go of the pen and the piece of paper and to begin to interface with a notebook computer. I'm saving that for next year, but once we have that in place, our electronic medical record will be full and complete. This year, back in July, Hospital and Health Networks magazine, which is a publication of the American Hospital Association, does a survey each year to determine the most wired hospitals in the United States. And we were very proud that we were selected this year as one of the 25 most improved hospitals in the United States, which, for a small little hospital in the middle of Washington County is quite an achievement. We have technology now that just a few years ago would have boggled the mind. Wireless access points throughout the building. Every clinical department, as well as ancillary department, is interfaced, and so it's quite impressive. Now, my vision one of these days is to